All right. Again, my name's Enrique Oviedo, and I'm the medical director of MATClinics, and we are an agency. We use the OBOT model, office-based opioid treatment. Um, so just a little bit about who we are. We have 4 offices. Our home base is in Dundalk, and that's where we see the majority of our patients. We have over 1,300 patients, and pre-COVID, just to give you an idea, about 70% of our patients, were stable, came once a month, left a urine specimen, got a monthly prescription. So about 70% of our patients were monthly patients. So for those that may be a little less familiar with the OBOT model, we do not dispense any medication on site. We don't administer medication. Patients come in, they see a provider, they leave a drug specimen, a prescription gets sent to the pharmacy, they go pick it up, and that's essentially the model. So COVID-19, as we all know, started in March, and we had to make a lot of adjustments. So we were constantly checking the DEA website, the SAMHSA website, the ASAM website, and things were changing on a day-to-day basis. And for a while there, it was a little bit overwhelming to try to keep up with all the new guidance and recommendations. So some of the changes that we made, from the start, people who were diagnosed with coronavirus or those with serious comorbid medical conditions, such as renal failure, COPD, others, we switched them immediately to televideo only appointments. And then we slowly started transitioning our stable patients, and then our kind of medium stability patients, and now we're essentially all televideo. We see all of our patients via televideo. The urine toxicology collection has been one of the biggest challenges, and we've had many meetings and discussions about what do we do with collecting urine toxicologies. And on one hand, we want to mitigate the spread of COVID-19. On the other hand, since we don't administer medication on site, urines are our only objective piece of data that we have to follow, patient stability. So what we did was we actually converted a different floor of our building into just the urine collection floor to limit exposure to our staff and our providers to the patients. And we only had 2-3 max patients at a time to leave their urine specimens. So essentially we have patients coming in, they leave their urine specimen, they leave, they go home, and then we essentially as soon as they arrive home, we start their televideo appointment. So that's some of the adjustments that we've made.